30-40-year-old female walking into the clinic telling to you that there is a gradually progressive hearing loss. Post pregnancy, this has got increased. There is a family history, and this all should point you towards the possibility that this is a patient who has otosclerosis. So now let's see what are the clinical features. Now we know that there is fixation of the foot plate of stapes. So if the stapes is fixed, will there be vibration of the foot plate? No. Even if there is vibration, there is reduction in the amplitude of vibration. And when there is a reduction in the amplitude of vibration, the sounds that are getting transmitted from the middle ear to the inner ear get reduced. And when the sound impulses transmission gets reduced, automatically the patient will have hearing loss. Now, will the deposition happen in one day? No. It's going to be slow deposition of the bone. So we are going to see here a gradually progressive type of conductive hearing loss. So in patients who have otosclerosis, they will tell you that gradually over a period of few months, 5 months, 6 months, a year, they are having this hearing loss. So typically the hearing loss is conductive type. It is gradually progressive. It is bilateral, but it could be asymmetrical. There is no rule that both the ears should have a same amount of hearing loss. But since it is a genetically predisposed condition, autoimmunity could be caused, infection like measles could trigger it, and genetics is one of the causes. We think that whenever there is a systemic pathology or a genetic predisposition, it should affect both the ears, and hence it is going to be bilateral. Unilateral cases also do occur, but what we see most common is going to be a bilateral case of otosclerosis. Now, what is the age of presentation? I have already told you, in the 3rd to 4th decade of life, usually between 20 to 40 years of age. It is higher in women and lesser in men, and the ratio is going to be about 2:1. So more commonly seen in women as compared to men. Some patients can have tinnitus. So we've talked about conductive hearing loss as the primary complaint. Some patients can have ringing sensation in the ear, which we call it as tinnitus. It would be seen more in patients who have an involvement of the cochlea rather than only stapedial otosclerosis. So cochlear otosclerosis patients would present to you with tinnitus. Vertigo is again an uncommon symptom, but if you get vertigo, again think of a possibility of cochlear otosclerosis. So whenever you get tinnitus and vertigo, think about the possibility of cochlear otosclerosis. So tinnitus and vertigo suggest to you the possibility of a cochlear otosclerosis. Now, what would the tuning fork test tell you? Now, typically we are talking about patients who have stapedial otosclerosis, and when there is a patient who has a stapedial type of otosclerosis, they would have a hearing loss which is called as conductive hearing loss. So what type of hearing loss they will have? They will have a conductive type of hearing loss. Now, when I do a test with tuning fork, I'll do first a Rinne's test. What would be better? Would air conduction be better or bone conduction be better? Since we are talking about conductive pathology, bone conduction is greater than air conduction, which is when we say Rinne negative. So in all conductive pathologies, Rinne's test would be negative. Where would the Webers get lateralized? It would get lateralized towards the deceased ear. Because in conductive pathology, the Weber is lateralized towards the deceased ear. Is there any role of absolute bone conduction test? No, because absolute bone conduction test talks to us about only sensory neural pathologies. So there is no role of having an absolute bone conduction test in these patients who have stapedial otosclerosis. But can we do absolute bone conduction test in those patients in whom we are suspecting cochlear otosclerosis? Yes. There the patients will have sensory neural hearing loss. So the absolute bone conduction will be shortened in those patients who have cochlear otosclerosis. So if you do the tuning fork test for a patient with stapedial otosclerosis, Rinne would be negative. Weber is lateralized towards the deceased ear, and absolute bone conduction would be normal. If there is a cochlear otosclerosis, purely cochlear, not a mixed one where they have conductive and sensory neural, I'm not talking about that. If they have a cochlear otosclerosis, what would be positive? Rinne would be positive, because if there is a cochlear otosclerosis, what type of hearing loss would they have now? Sensory neural. And in sensory neural hearing loss, Rinne is positive. Weber is lateralized towards the opposite ear or the better ear, and absolute bone conduction is reduced. So this is what would happen if you have a pure cochlear otosclerosis. If there is a combined, having both conductive and sensory neural element, the Rinne would be negative and absolute bone conduction is reduced. When Rinne is negative, what does it tell me? Conductive hearing loss. Absolute bone conduction is reduced. What does it tell me? Sensory neural hearing loss. So if I have both of these tests showing us an inference like this, what will I think? It is a mixed hearing loss, and mixed hearing loss would be seen in combined form of otosclerosis. So pure stapedial, you know what are the findings. Pure cochlear, you know what are the findings. And mixed or combined otosclerosis, now you know what are the findings. What is Jelly's test? Jelly's test is again a tuning fork test. What do we do in this Jelly's test? We will put a Siegel's pneumatic speculum in the external auditory canal. So if I take this as the external auditory canal, I have the Siegel's pneumatic speculum in the external auditory canal. What would I do with it? I will increase the pressure in the canal. So what will I do? I'll increase the pressure in the external auditory canal. Now, when I increase the pressure in the external auditory canal, will the tympanic membrane get pushed in? Yes. Will the labyrinth be pushed inside? Yes. Now, will the stapes footplate go and get pushed to the oval window? Yes. Now, will this result in increase in the labyrinthine pressure, especially the movement of the perilymph? Would it increase? Yes. So this is what will happen if I increase the pressure in the external auditory canal. It will push the tympanic membrane and the ossicles inward. This would raise my intralabyrinthine pressure. And when the intralabyrinthine pressure will increase, there is immobility of basilar membrane causing reduced hearing. So if my labyrinthine pressure will increase, the mobility of the basilar membrane will decrease, and what would happen? The patient will have decreased hearing. Ideally, unless we have a communication between the middle ear and the inner ear, the pressure changes will not get transmitted. But here we are forcibly pushing the footplate of the stapes against the oval window to increase the translabyrinthine pressure, not to a significant extent that the labyrinth will get active, but to an extent that the basilar membrane becomes stiff or has a reduced mobility. So this is what we see in normal patients. So when I increase the pressure and if I give a sound impulse, the patient will have reduced hearing. That's normal. But if there is a patient who has otosclerosis and the footplate is already fixed, when I increase the pressure in the canal, it goes to the middle ear and the ossicles. But since the footplate is fixed, that very minimal or very small pressure change that I have done, can it go to the inner ear? No. Will it affect the basilar membrane? No. And will it affect the hearing level of the patient? No. So what is happening here? No change will be seen when the ossicular chain is fixed or if it is disconnected. So what is normal in Jelly's test? When you increase the pressure in the external auditory canal, the patient will have decreased hearing, which is normal. But since the patient has got otosclerosis, increase in pressure will cause no change. So increase in pressure will cause no change in hearing in those patients who have otosclerosis. So this is what you would see in patients who have otosclerosis on a Jelly's test.